In the Vietnam War, lots of soldiers used heroin overseas. War kind of sucks, so it's a ripe environment for heroin addiction. There was in fact such a big concern coming back home that there were lots of programs in place to make sure that this heroin addiction would not become like a massive societal problem. It turns out that only a very small percentage of people that were addicted developed heroin addiction. They had access to heroin, they used it again, and still the vast majority of them did not develop heroin addiction. When you get home, you're back with your wife, you're in a nice family, you have a nice surrounding, you don't risk getting shot every day. Suddenly, heroin addiction is not such an appealing life choice anymore. Similarly, we see that heroin addiction is ripe in areas with very low quality of life. Now, of course, this is probably a bidirectional relationship. People that generally don't take care of themselves very well and develop heroin addiction, they are not going to make for the nicest neighborhood. But also, if you're in a neighborhood like that, you're much more likely to develop an addiction because life sucks. And it's much harder to make things better in your life in that scenario. So it's much more tempting to succumb to something like a heroin addiction or a cocaine addiction.